Fibro TV, making positive connections in the chronic illness community. Hello everyone, my name is Jen Reynolds, creator and founder of fibrotv.com, and this is going to be our second video in our video series that I'm going to be putting out. I didn't expect to go like a whole month without doing one, but you know, life happened and my job is to take care of my health first and my personal needs before I can give to others. That's been a big lesson that I've been learning the last year or so. So today we're going to be talking about when treatment options no longer are beneficial to you. And this is for anybody with chronic illness. Like I've said in my last video, I'm not a doctor. I'm not a healthcare provider. I'm a patient that has been diagnosed with lupus and fibromyalgia and avascular hip necrosis. And I just know what I have done that has helped me and not helped me, and what many other people have done, because I talk with a lot of people with chronic illness because of the website fibrotv.com, what they have done. And I figured, hey, why not learn from my mistakes or from other people's mistakes, or at least not feel alone if you're going through the same thing. So the first thing I wanted to bring up is not speaking up at your doctor's appointments. I was so horrible at this. There was certain treatment options that were no longer working for me. And I kept staying on them, hoping that they would work again. I see this happening a lot with some of the newer medications for pain, like Lyrica. People, when they first go on it, they feel that it's very beneficial at first. Their pain levels go down, they start functioning better, and then the side effects start kicking in. And this is not everybody. For some people, this medication works wonders. So I don't want you to feel that I look to the side, because that medication is horrible for your body. You just need to know that, first of all. It's just really bad for your body. And if it's working for you, I say if what you're doing is working for you, stick with it. I'm a big advocate for that. But when things start going bad and going south, staying on a medication or a treatment plan that is not beneficial to you anymore is a recipe for disaster, literally. I'm using Lyrica as an example. There's other medications out there. I don't want to just make this like a bad thing about Lyrica, but this is one of the ones that probably has the most side effects. And people are on it for a few weeks and they say it works so good and they're getting their life back. And, you know, a month later, they've gained a good 25 pounds, and it's not even weight, it's water weight, which is horrible on your heart. Edema is just, it stresses out your heart. It's not good for you. And it doesn't seem like the weight thing evens out. It just keeps going. And I've seen a lot of people gain 100 pounds on this medication. And you have to outweigh the risk and the benefits when it comes to medications like this. I know there's people that are in so much pain, they will take anything to be out of pain. I don't think that's the greatest option either, but I understand your desperation because I've been there. I used to be on 12 medications and I was 220 pounds. You know, I've lost a good 100 pounds and I'm not on any medication anymore. And that was a long, long journey. Trust me, I did not just go off of 12 medications. It's been hard and long, and probably the best thing I ever did for myself personally, just because the medications just were not working for me anymore. So if you are on some kind of treatment plan and you know it's not working anymore, speak up at your doctor's appointment. You got to remember, doctors work for you. your healthcare provider, whether it be a chiropractor, a doctor, a naturopathic physician, whatever that you choose to see and who you decide to be a part of your healing journey works for you. They have the right to say no to any treatment, but they don't have the right to keep you on something that's making you get worse or feel worse. Because I can promise you, if you are on a medication and it worked at one time and it stopped working, you continuing to take it does not improve the chances of it working again. It's not meshing with your system, basically. Also, if you decide to go off a medication after watching this video, please do not do that on your own. See your physician, your chiropractor, whatever your healthcare provider is, and make sure they at least know that you're going off, or they can wean you off if there's, a lot of the medications like SSRIs have horrible withdrawal. I don't know about Lyrica because I never took that one. But I know a lot of these medications, you must go off slowly if you're going to do it. But let's get back to the point of this video. If something is not working, that is basically the definition of insanity, is to keep doing the same thing over and over again and expecting another result. So my message to you today, this is going to be short and sweet, is if it's working for you, stick with it. If it's not working for you anymore, it's time to change and shift direction, because nothing is going to change unless you make that change in your life. And nobody can do that for you. No doctor is going to make changes for you. Nobody can do that but you, and only you know your body. And be your own advocate. Speak up for yourself. Tell a doctor if you're feeling like crap. Who cares if they think you're a hypochondriac? Who cares if they think you complain too much? They're your doctor, and they need to know what's going on with your body. And if they just keep loading on more and more medications, I don't think that's going to solve things. Taking medications for side effects of another medication is where people start spiraling downhill. I would definitely look for other options. I mean, you don't have to stay with the same doctor. You can look for another doctor if they no longer resonate with you, or they're no longer compatible with your healing journey. It's perfectly fine to change doctors. You need to do what's best for your health and for your well-being. It's not your doctor's life. It's not your naturopath's life. It's your life. And you've got to do what you've got to do to be as healthy and to get as well as possible being a person with chronic illness. Well, I hope that this video helps you out in some way. If you have any comments, questions, or opinions, go ahead and leave it right below in the comments. You could do it either here or on our main page at fibrotv.com. And make sure to add us to YouTube. If you are added to YouTube, you get these videos before anybody else because you're subscribed. And that is youtube.com/fibrotv. It's been great talking with you guys. I hope everybody has an amazing week. We're already halfway through. I can't believe it. And until next time,